topic is Developmental Origins of Health and Diseases by eminent personality, Dr. Latha Venkataram. She is a consultant at OBGYN Rangadore Memorial Hospital, a unit of Shringeri Sharada Peetham Charitable Trust. She has been the past president of Bangalore Society of Obstetrics and Gynaecology. Currently, she is also the coordinator for Medico Legal Committee of Bangalore Society of Obstetrics and Gynaecologists. She is a national expert on diabetes and pregnancy, Public Health Foundation of India. She is faculty and guide at SVYASA University of Yoga, Bangalore. She is a postgraduate teacher for MRCOG. And a lot of other achievements she has on her records, but due to shortage of time, I'm skipping some of them. But I'm sure with her talk, you will understand the depth of her wisdom and the knowledge. Madam, floor is open for you.
Thank you very much for that elaborate introduction. I'm overwhelmed with all your hospitality, very nice food, very nice people, and what else? Yeah, very nice lectures. So, truly, it is such a mixture of enthusiastic professionals who really want to know what should be done to improve the quality of life, quality of our progeny, on the whole, the quality of life of human beings. Can I just use this? Yeah. Sure. Thank you very much. Very interesting topic. Developmental origins of health and disease. DOHAD is the short form, and we are going to look at the importance of the topic. What is DOHAD? Mechanisms of DOHAD, effects of DOHAD, and possible solutions. The magnitude of problem. Do we all agree that NCDs are, that is non-communicable diseases, are becoming the biggest killers? Yes? 70% of deaths annually world over, that is 40 million deaths annually, is due to non-communicable diseases. And look at this, unfortunately, 15 million premature worldwide deaths occur due to NCDs. So what quality of life are we having? Is it only the tobacco, alcohol, substance abuse, poor diet, physical inactivity that are killing us? Or something else? Where does it start then? Does it start in the womb? Probably yes, or even before, right? Adverse experiences during critical periods of growth, that is prenatal, childhood, and adolescence, can be driving the NCD epidemic. That's the, it is 2017. Fast pace of urbanization, consequent epidemiological nutrition transitions, etc., etc. We'll come to it a bit later. Earlier age and disease progression at a faster rate, especially in developing countries. You are seeing 4 out of 5 deaths, mainly in low and middle income settings. So what's happening? Let's think about it. We should definitely think about in utero programming. We pass more biological milestones when we are unseen individuals, hidden within the womb. Do we all agree? Such a rapid development, physically, mentally, etc. The growth, biological milestones are much more when you are unseen. How we pass these milestones will be greatly affected by our first environments in the womb and immediately after birth. Nearly 98% of the programming imagine this is the hardware and what you're loaded with, that is the programming happens within the womb and 2 to 5% up to the age of 2. And what softwares you are going to put in later depends on what hardware and how it is programmed, right? So what we are physically, mentally, intellectually, and spiritually dates back to these milestones when we didn't know who we were. Amazing, isn't it? So what is DOHAD? This postulates that exposure to certain environmental influences during critical periods of development and growth may have significant consequences on an individual's short and long-term health, that is in utero health and also ex utero health. Clear? So we should talk about fetal programming. Developing fetus, if exposed to a hostile uterine environment caused by insults such as stress, poor nutrition or malnutrition, infections, chemicals, metabolites, or hormonal perturbations, responds by developing adaptations. These are called predictive adaptive responses. I'll give you examples to make the understanding better, that not only foster its immediate viability, but also its survival if a similar environment is encountered later in life. Now, what happens is, adverse condition, that is, it could be maternal pregnancy complications, or it could be something like maternal malnutrition. It can be malnutrition or malnutrition, MALL. Okay, yeah. We are all highly nourished in the malls now. Okay, now, right. So smoking, many medications, hypervitaminases, so many things. They can have adverse effects on pregnancy, produce adverse conditions. There can be epigenetic modifications and impaired fetal developments. So it determines lot of important structural and functional organization of this baby. That is, for example, low number of nephrons, arterial remodeling. It could lead to not only renal disease but hypertension, later on cardiac disease. Insulin resistance that develops in the womb can lead to metabolic disease. Okay, so now there is something called as developmental plasticity. Previous speaker touched upon this. This developmental plasticity, you can have a genotype which is supplied by both the parents, but what expresses, okay, is very important. That is developmental plasticity. The environment has got a big role to play on this developmental plasticity, that is the adaptations, and the adult phenotype is determined and it is almost sealed. 98%, as I said, 95 to 98% of the programming takes place when the baby is within the womb. This is called as Thrifty phenotype hypothesis, proposes that it makes irreversible changes in its development. So you can't change the number of nephrons, the number of islet cells, the number of muscle mass. For example, if the nephrons are less and if the baby is exposed to, if the baby after it's born is exposed to stress, it might not be able to cope. The renal functions might not be able to cope with the stress. Okay, then it develops hypertension. Pancreas, if there is lesser number of islet cells which secrete insulin, and if the baby grows fat or the adult grows fat, he or she might not be able to cope and she or he becomes diabetic earlier in life. Muscle mass, again, even cardiac muscle mass is affected. So these people might develop cardiac problems earlier in life, for example, heart attacks. And myocytes, as I told you, liver cells. There can be alterations in lipid metabolism. All these, many of these leading to metabolic syndromes, which affects the quality of life considerably. So, predictive adaptive responses. So, what this individual is going to be, in the sense functionally and anatomically, is going to be determined by the environmental factors. And if there is a mismatch, that is, for example, if there is maternal malnutrition, to maintain its glucose load, I don't know whether you will be able to sort of get me, but I'll try my best. To maintain the glucose load, the baby increases the insulin resistance, thereby to maintain its glucose in the blood. But, so okay, intrauterine atmosphere has been challenging, so the baby develops resistance. But what happens once it comes out? When it has a glucose load, the normal glucose load, it might not be able to cope because there is already insulin resistance. There is already reduction in the islet cells which need to secrete insulin. So what happens? There is a nearly 17-fold chance of this person becoming diabetic by 17 years of age. Okay? I'll show you the figures later. So this mismatch and poor fit, therefore, would predispose them to higher risk of certain NCDs. Risk is further exacerbated by excessive weight gain. That's what is happening in India. We are thin, fat Indians. You all know that BMI is much lower for our country for disease prediction. So, but our visceral fat is so much. Where does it get determined? It is in utero most of the time. Now, proposed mechanism of early programming, permanent structural changes, as I said, epigenetic programming of gene expression, accelerated cellular aging. So, deaths are occurring earlier. Now, what are the factors which could influence the environment? Mother's nutrition, body composition, stress levels. This is playing a havoc. Lifestyle, smoking, alcohol, substance abuse, and IT capital, India, especially Bangalore, where I come from, is the IT capital. People are obese. They are just potatoes in the couch. Okay, couch potatoes. Thank you. And we see a lot of complications during pregnancy. And what sort of progeny are we expecting? In the name of materialism, in the name of earning and being happy, what are we ending up with? One has to seriously think about. Complications of pregnancy, diabetes. I run 2 diabetic clinics in a week. Nearly, 25, 30 women. It breaks my heart because diabetes begets diabetes in the progeny. Preeclampsia, IUGR, prematurity, all these are an increase. So, just in a nutshell, environmental factors, there could be undernutrition or overnutrition, stress, infection, all these increases maternal stress physically or mentally. There is increased glucocorticoids and increased fetal glucocorticoids, which affects the growth, organ structure, cell numbers, gene expression, neuroendocrine function, that is HPA axis. HPA axis is very, very important, okay, for the mental and physical fitness of an individual, and also the metabolism leading to adult disease. This adult, when she gets pregnant, again she is going to perpetuate the same thing. Now, stress is a very important thing. We did see beautiful slides from the previous speakers. HPA axis is set at a different level if the mother is under stress. The fetal HPA axis, that is hypothalamus pituitary adrenal axis, is very, very important for a human being. Okay. Now, this is a famous thing which it was nearly 10 years ago. How the first 9 months shape the rest of your life. Very important to know. And look at this, 95 to 98% of epigenetic modifications are in the fetus, as it is 2 years, yeah, beyond which you're a toddler, etc. So here it just tapers off. So you have maximum opportunity to give the best. If you want to have the best, then the child is within the womb. Nutrition, one third of our, I just want to take a few examples of how this DOHAD, what are the effects of DOHAD. One third of our world's population, mostly in developing countries, suffers from some form of malnutrition. 815 million from calorie deficiency, but 2 billion from being overweight. That is a problem in the developing countries. So you see premature deaths. No wonder. Now, adapted birth phenotype, because it wants to survive in the intrauterine atmosphere. So, if there is Barker's hypothesis, which was published nearly 30 years ago, but better chance of fetal survival, but increased risk of adult disease due to these adaptations. So, low birth weight can be associated, or even large for dates can be associated with coronary artery disease, hypertension, glucose intolerance, asthma in childhood, immune dysfunction, renal failure, raised cholesterol, cortisol, all these leading to all these. What else do we want to add to the list? So now it is not only in utero, birth, and childhood. Childhood, if there is childhood obesity, especially when there is a catch-up growth, especially for these IUGR babies, you can have tremendous problems. Adult obesity, hypertension, diabetes, they are much, much more prone for metabolic syndrome at much earlier age. So now, early growth restriction, SGA, all these make the individual suffer the primary cardiovascular program in utero, and they are sort of prone for all these stroke, obesity, diabetes. So we are seeing more and more heart attacks in younger and younger age group in India, more and more strokes in younger age group. This is one of the biggest reasons. And not only that, neurocognitive disorders, learning disabilities. You want quality of life, but what are we achieving? Yeah. So these are, IUGR preterm infants are greater risk for poor neurodevelopmental outcome. Preterm fetuses, stress is one of the biggest causes for preterm deliveries if there are no other issues. So, and also the other causes for preterm delivery would be, etc. So, on the whole, the preterm infants are on the rise. Obesity, obesity is a big problem, and the obesity during pregnancy, all these preeclampsia, GDM, all these are on increase. Thereby, the quality of progeny. Yeah, baby looks very chubby. Indians are very fond of chubby baby. Wow, yeah, it's really chubby, it's really cuddly. But it's going to be, flat very soon with a lot of problems. So don't make the baby fat, especially between 2 years and 7 years. That's what determines all these risks apart from the intrauterine risks. Not only that, mental impairments in visual reception, motor skills, receptive and expressive language, as well as adaptive communication and socialization in women who have had diabetes, hypertension, and obesity. Okay, more of ASD also, developmental delays, etc. So obesity, more problems during pregnancy, less optimal or suboptimal progeny who is more prone for disease, and again she getting pregnant and she is more prone for diabetes and obesity, and there is perpetuation of metabolic syndrome. Now, does it begin in utero? Yes. Yeah, diabetes begets diabetes, obesity begets obesity. Fat cells are the largest endocrine glands, and they are notorious for producing a lot of inflammatory substances etc., etc. You have seen this slide. Yeah, I'm going to talk about a bit of diabetes because 1 in 5 women or 1 in 4 women are diabetics in India, especially during pregnancy. Very sad, very, very sad, because that will make their progeny become diabetics quite early in life, because there is altered fetal islet function and inflammation, epigenetic modification, childhood obesity, pubertal obesity, lots and lots of PCOS you see, impaired adult and islet function. They will already be, I'm seeing more and more of pre-pregnancy diabetics, type 2, which is very sad again. And there is again increased maternal fuels, and again GDM and obesity in the progeny. So we are perpetuating it through generations. By 17 years of age, 1/3 of over diabetic mothers have had evidence of IGT or type 2 diabetes. So you can remember either 17 at 17 or whatever. Women with GDM have an increased lifetime risk of developing diabetes. Okay, so GDM makes them more prone to become truly diabetics within 5 to 10 years. 50% of them can become diabetics. So 2 generations are at risk. Okay, now increase in metabolic syndrome, 17-fold increase, and a 10-fold increase in overweight at adolescents. And these are the people who can die prematurely because of the diseases. So now, more the sugars, more the problems, and more the obesity. Sorry, due to paucity of time, I have to skip through these slides. But even seizure disorders, mental retardation, behavioral disorders are all the effects on long-term effects on the offsprings of diabetics. Yeah, sure, thanks. Yeah. Now, when within the womb, this is what is happening. We can't see it. Small for growth, large for growth, truncal visceral obesity, insulin resistance, inflammation, hypertension, dyslipidemia, cardiovascular disease. But when the child comes out and starts growing, that's what you see in adolescence, early adolescence, in utero programming and metabolic syndrome. Very sad to see this slide. Honestly, I feel pained to see this slide, though it's beautiful background. Now, neurodevelopment, autism spectrum disorder, ADHD, all these are increased in diabetics, not only diabetics, but almost, it is much more increased if it is associated with maternal obesity also. So, poorer performances of the offspring, both in IQ and motor development tests, significant expressive language impairments in young children, which is, it's in diabetic mothers, which is rather sad. I don't want to talk much about pathology and problems, but anxiety and depression during pregnancy can lead to poor pregnancy outcome, especially preterm delivery, low birth weight, and growth restriction due to mother not taking care of herself properly and due to psychotropic medications, etc., etc. So now this is an old study, but there is increased incidence of ADHD, anxiety, and conduct disorder in children aged between 4 and 7. It is doubled from 5 to 10%, with maternal anxiety, which was measured at 18 and 32 weeks of pregnancy. Antenatal life events, more than 3, I would say, stressful events in life is associated with a reduction in the MDI score, mental development index. MDI is mental development index. So relationship problems, again, MDI score drops. Even if it is one episode of relationship problems, or yeah, it can. Yeah. So pass grade in mathematics, Journal of Child Psychology and Psychiatry, antenatal anxiety was also associated with an independent predictor of poor maths. Okay. Well, schizophrenia is again attributed to maternal depression during pregnancy. Unfortunately, it's not all over at birth. Impaired fetal growth followed by rapid catch-up in infancy is a strong predictor of obesity, hypertension, and non-insulin dependent diabetes and cardiovascular disease. So, sensitive early mothering can reverse some of the effects. Don't allow the baby to become fat. Postnatal nutrition, breastfeeding especially, it has got lot of advantages. I think we have to talk about new developments. It's just not, the ultrasound should just not be picking up the structural defect. Okay, we should be advancing to see the functionality of the fetus when it is within the uterus so that you encourage the lady to do better, to bring out a better progeny. Okay, I think days are not very far. So if you are, so as I said, this is the maximum chance for a human being to be programmed better when you are in the womb, when you don't know who you are. Okay, but look at this, all the interventions. So if you miss this opportunity for correction, you have missed it forever. You have truly missed it forever. So no pill can help you. Nothing can help you, but what can help you? Education. Obstetricians, midwives, all of us put together should be educating our couples, yeah, who are contemplating the pregnancy or who have become pregnant to say, look, there is something called as DOHAD. If you want to have the best, give it the best when it is in the womb, and first few years are very important. Garbha samskaras, I can't appreciate this movement, I should call it as a movement better. It should become a movement if we really have to improve the quality of human beings. And also, it is not only, yeah, I think it should become a movement, and with Manashakti and APA, who are very determined people, I'm very enthusiastic that it will become a movement. All of us should join hands to have better progeny, better world. Okay, lifestyle modifications, yoga, pursuing hobbies. How many pregnant women pursue hobbies? Hardly. And they are all glued to this media. I mean, this media has done more havoc than good. There are so many nice things to see and enjoy. It should be memorable. Each pregnancy should be memorable, cherished, relished. But what is it becoming? At least in India, everybody thinks that they're going to have a problem. The stress levels, especially in urban, we are doing a study with NIMHANS, that's the National Institute of Mental Health in Bangalore. Stress levels are much more, even in the lower socioeconomic strata. Oh, somebody had this problem, somebody had that problem. Media has created, especially the Facebooks, WhatsApp, etc., rather than talking about good things. Very sad. Very, very sad. I find it, as a doctor, quite difficult to sort of reverse this. This programming of the mother itself. So how can I reverse the programming in the fetus? Okay. Now, so we have to talk about ahar, vihar, and vichar. That is the diet and what you think about, how you think about. Vichar is what you think about, and vihar is how you spend your time. Okay. Now, why can't we go back, practice all these? Beautiful. Discipline yourself, devote, become a devotee. Beautiful concepts, Indian concepts. Information on pregnancy planning, and I think we should bring out a booklet to talk about how you have to take care of pre-conception period. And doctors and Manashakti, APA, everybody put together. I don't know whether it already exists, and it does exist on the website, I believe. So my obstetrician friend told me. But I think we have to make it more popular. So we should always, as obstetricians, we should take time to say, how the first 9 months shape the rest of your baby's life. Do we do that? How many of you are obstetricians in the audience? Oh, quite a few. Do we all do that? Yeah, we do that. Yeah, because you have come to Manashakti, I'm sure you're doing it. But if you ask a general obstetrician crowd, it might not be so. Readiness for parenting, involving the father, family, managing stress, identifying high-risk mothers for such problems who would produce a poor progeny. Give the best to have the best. Truly, you should, and we should motivate our women. Thank you for listening. Matru swasthyam, loka swasthyam. If the mother is healthy, the world is going to be healthy.
Hello.
Thank you. Namaste.